I hope you can.
We can.
Yep,
Ariel.
I see several people saying yes. So welcome everybody to the webinar measurement for distant teaching and learning during COVID-19, a situation that is still very present in many of the countries where we work. Let me start saying that I'm Argentinian and I'm based in Bogota, Colombia, and I'm working for INEE, as I said. So today here we are all together to think on the to take into account the quality part of the education during the COVID pandemic, and to think about how to measure the learning outcomes during the distance education. For this, we have a very interesting panel, and I will go through very briefly through the agenda that we have today. After this brief introduction, we will go to Mona Yunis and Asim Latif. Mona Yunis is an active member of the Education Distance Coordination Working Group, and also she's a consultant. She has a PhD from the Lankan University, and also she's part of INEE network since 2014 and part of the task teams. Asim Latif is the coordinator of the newly established Distance Education Coordination Working Group. After that, we will go also to talk a little about the technical data and measurement of the issue and presented by INEE by Yasmina Haddad. And later on, we will go to 3 very interesting presentations about organizations that have been implementing practitioners, has been doing the work of keeping the education ongoing during the COVID pandemic. We will have Aramba Project with Devi Carrey. We'll have Young Love with Mochepi and Emi Yang, and we will have the Girls Education Challenge with Barbara Hershey and Karit Hari Walala. And to finish that, we will have a brief questions and answers with all the presenters, where we will be able to discuss a little all the presentations and the findings from the practitioners who has been implementing education and trying to measure distance education during these COVID times. Say that, I will give the floor to Mona Yunis. Thank you very much to everybody.
Mona, you're on mute.
Hi, hello everyone. Thank you for joining. A couple of very quick webinar housekeeping points. The participants' audio and video are disabled because we have a big number of participants, and only the panelists will be able to speak or to open their videos. Please do post your questions using the Q&A function at any time, and the panelists will try to answer your questions either in written format or verbally after the presentation. This session is being recorded and will be shared with all those who have registered by email, and can also be found afterwards on the INEE website. There are closed captioning available in English. If you don't see the closed captioning, you might want to turn it on, the little button on the right. The recording and the presentations will be shared, as I said, on the INEE website. Now, very quickly, I will turn over to Asim Latif, coordinator of the Distance Education Working Group. Thank you.
Thank you, Mona. Hi, everyone. It's a pleasure to connect. So using this opportunity, I wanted to basically introduce the Distance Education Reference Group, which the INEE has recently set up in November last year. Considering the needs of distance education in education in emergencies. So this group has been primarily set up with 2 objectives. And the first one is to produce, curate, and share guidance on distance education in emergencies. And the other one is related to advocacy for quality, safe, and relevant distance education solutions. So we've just finalized our work streams, and we've finalized our work plan. So we have a range of activities which are going to be undertaken in the coming 1 year. Primarily around evidence, knowledge management, guidance and tools, and advocacy. And we've just recently began our work on the guidance and tools work stream, and we are finalizing a concept note taking a holistic view of all the issues which the distance education field is having in terms of education in emergencies. And very soon you will see a very comprehensive note from INEE's side. So there are a lot of other range of activities as well which are planned. Next slide. Next slide, Andrew. Yeah, so just to give you an idea, like members from these leading organizations are part of the working group. You can say World Vision, Plan International. So all of the members have come together to contribute and really, you can say, collect and share guidance on distance education. Next slide. So the best part is that we would really want you to, get in touch with the group. We have a dedicated Slack channel on distance education. It's an open channel. Please feel free to join it. And the best part is that all the members of the working group are part of this channel. So you're free to ask them any technical issues, refer any good resources which you may have, started implementing yourselves. So we are available. I'm available. So I'm chairing this channel as well. So we hope to see you join this channel and looking forward to further coordinating with you guys. Thank you.
Okay, next to that, and without further ado, I'm going very quickly to introduce Yasmina Haddad. Yasmina Haddad is an incoming qualitative research associate with American Institutes for Research International Development Division. She is also experienced teacher and an experienced researcher with expertise in inclusive education, education in emergencies, and INEE's minimum standards. Yasmina just recently received her master's degree in education, in international education policy and management. And during her graduate studies, she worked as a consultant for INEE, where she supported INEE standards and practice, capacity building, and data and evidence efforts. Yasmina is currently a co-convener of INEE's Inclusive Education Task Team. Thank you. Congratulations for your master's degree, Yasmina. And let's start.
Thank you so much. Thank you. Hi, everybody. Thank you so much for being here today. Thank you for that introduction, Mona. And thank you to INEE for inviting me to speak about this project that I worked on last year. So here today, I'm here to talk about the INEE technical note on measurement for education during the COVID-19 pandemic. Andrew, if you could put the next slide, please. Thank you. So before jumping into the specifics of the technical note itself, I wanted to situate it alongside another technical note that INEE released in April 2020 of last year. So last year, when INEE released the technical note, we were still very new to this pandemic and did not understand the long-term effects it would be having and that it would continue to be with us over a year later. So back then when we wrote the technical note, you could see the structure here on the screen. It talks about taking care of yourself, coordinating your work, analyzing your context, developing your activity plan, and reviewing your progress and your quality. This technical note, the first one that INEE released, includes a lot of information about the INEE minimum standards to help you guide your response to the COVID-19 pandemic, as well as resources and COVID-19 resources collected by INEE and disseminated in order to support your work as well. So then you fast forward to August 2020 and then later November 2020 when this technical note on measurement was released. And we learned a lot more about the pandemic in those 4 or 5 months in between. And in those months, we realized this pandemic was, like I said, going to be here for a long time. And so we wanted to first take this approach to our response and tweak it a little bit to better reflect what it is that we are experiencing as practitioners. So our first step was to make it a circle, because us as measurement professionals, we love iterative processes. And so we wanted to make it clear that we are going through this time and time again, continually trying to improve our response and our programmatic response so that we can better support the learners and other people who are benefiting from our programming. Another thing you might notice is that take care of yourself is now has now engulfed the entire process. We realize that this pandemic has taken a toll in many ways on all of us. And so taking care of yourself has to become a #1 priority throughout the entire process, making sure that we are physically and mentally able to give our all at work. Sometimes that means taking a mental health day. Sometimes that means working a little later. So taking care of yourself has become something that we realize is very important in this response. And so the technical note itself that I'll be talking about is actually really focused on these two arrows, the green arrow and the white arrow. So the green arrow saying revise, progress, and quality, and the white one saying refine, revise, and update your activity plan. So first I want to talk about the process and how this technical note came to be. Andrew, if you could go to the next slide. Thank you. So the process was really exciting for us because it included many INEE members. The way that we approached writing this technical note was by hosting an online workshop entitled How Do We Monitor and Evaluate Distance Learning Programs During COVID-19? Initially, the goal of this workshop was to allow the education and emergencies community to come together around key technical questions and challenges that we faced during the COVID-19 response. The workshop itself included 24 evaluation specialists from 13 different countries. Discussions were facilitated by the technical experts you see on the screen. And the technical note itself was drafted based off of notes and audio recordings from this workshop. Halfway through the workshop, we realized, or halfway through planning the workshop, we realized we were going to learn a lot from this workshop from our INEE members. And we wanted to make sure that these learnings lived on. And so that's how this technical note on measurement came to be. Very much a group effort and a process that was informed deeply by INEE members for INEE members. The next slide, please, Andrew. Thank you. So within the technical note itself, you see 5 different subjects that we discuss. The first one is overarching distance education measurement considerations. So these are considerations that, like I said, apply across the entire process. That includes taking care of yourself, but that also includes ethical considerations as well. We also discussed formative learning and evaluation. Like one member of the workshop said, we are building the plane as we are flying it. And that is all the more true during a time like a COVID-19 pandemic. And so we talk about what does it look like to learn more and to develop it as you are running the program as well. We also talked about measuring access and reach, which is something that's really been a hot topic during distance learning because we do know that in some ways distance learning can exacerbate inequalities. Then we also talked about learning outcomes. That's kind of what we all want to know, right? Is the program helping people learn? In what ways? In what ways is it not helping people learn? And how can we improve? And then finally, we take a deep dive into measuring social and emotional well-being in the distance education context. So of course, while this has always been important for us in education and emergencies, it is all the more important because the people who we are working with and who we have been working with are now experiencing what some might call a compounded crisis. Whatever education and emergency context they were living in before also now includes the pandemic. And we have this additional barrier of needing to do measurement from a distance modality. So it was really important for us to also discuss what does it look like to measure social and emotional well-being from a distance as well. Next slide, please. Thank you. So if you want to know about the nitty-gritty of the technical note itself, I highly encourage you to download it and read through it. It includes a lot of really interesting tables and examples, 2 amazing case studies that you're going to hear more about today, as well as other guidance for you and references to the INEE minimum standards and to the first technical note as well. But here I just wanted to highlight the key takeaways that we kind of pulled from our members and from what we learned from our workshop. So like I said before, taking care of yourself, of course, is very important. Then looking at prioritizing, safeguarding, and ethical considerations. And this might look like thinking about the questions you want to ask your participants and wondering, is this a data point I really need? If it's not, and if this data point might require meeting at a distance in person or might require more internet access or something of that nature, in order to prioritize safeguarding and ethical considerations, sometimes it means not collecting that data point. And sometimes it means that data point's really important, so it is worth asking them to get on the phone for that extra few minutes. So always thinking about what does this mean in terms of safeguarding and ethical considerations for our participants. Another thing that came up a lot in the workshop was prioritizing heightened transparency. This is key as always, as researchers, we always want to mention what our limitations are. And this becomes, if anything, more important now during the COVID-19 pandemic. And what we mean by that is saying, listen, these are our limitations. So in this way, we cannot generalize our findings. Or we really would have liked to have done this extra thing that would have given us more data, but we didn't have the funds. So maybe next time we will try that if we have access to the funds. Heightened transparency, I really believe, is how researchers can work together and build upon each other's work, as well as measurement and evaluation specialists too. So now we kind of shift over to considering sampling bias, as well as prioritizing, understanding, and addressing barriers to access for learners. So what this means is that we have to be cognizant of who we are able to reach with our programming, who has a cell phone, who has access to TV or to the radio, or to the paper packets of work that they might be using. And in this way, we can also make sure that we are generalizing our findings as far as they can go. So maybe we can't say learners with disabilities, this program would work for learners with disabilities, because perhaps the way that the program was laid out might not be able to reach those learners with disabilities. So really being cognizant of who our program is working for, when, and within which context. And then another really important finding we found was that reporting unintended beneficiaries can really highlight the benefits and the positive aspects of distance learning education. And you will hear more about that in somebody else who will be speaking today. But thinking about, okay, so we have a distance modality. That means that kids or learners who might not be able to travel can now attend our session. What does that mean? And what does that mean for inclusivity as well? And finally, being innovative and creative with our program delivery and data collection is number one key takeaway from that workshop. I was there for the hour and a half of hearing INEE members really speak to how they found ways to overcome barriers in really very short amount of time. And what motivated them and what really helped them go through it was their amazing, innovative, and creative ways of working. And so I really encourage you all, as you listen to the rest of this webinar, to think about how these two members who are going to be speaking after me, how they might have inspired these key takeaways. Because I just want to say one more time, this technical note, I might have written the words, but really the content came from INEE members. And I think that's what makes it really special and hopefully really useful for you all. Thank you all for your time. And I'm excited to talk perhaps during the Q&A. Thank you.
Thank you, Yasmina. Very interesting. Now we will move to the next presenter. We have Devi Carrey. She is the Global Monitoring and Evaluation and Learning Advisor at People in Need. She provides technical and advisory support to People in Need missions across the world. She conducts evaluations, helps build and strengthen organizational monitor and evaluation systems at project and country program level. She has been the monitoring and evaluation lead at People in Need Nepal's Leave No Girl Behind project since its inception in 2018, and has continuously adopted, contextualized the monitoring and evaluation processes within an ever-changing field situation. Thank you. Now to you, Devika.
Thank you so much, Mona, for that beautiful intro. Hi, everyone. A very good evening, afternoon, or morning from wherever you are connecting with us today. I am currently based in Nepal, and it's a very good evening. Like Mona said, I'm engaged with People in Need and with Leave No Girl Behind project that is being funded by the UK Aid and is part of the wider Girls Education Challenge program of UK Aid. So we are very happy to be here and share some of the very interesting, also for us, insights that we received as we went along adapting our system, adapting our programming in this unprecedented time. Next slide, please, Andrew. So just to give a brief overview of the project, so you know slightly the context that we are working in. Our project is called Arambha. It is a Nepali word which directly translates into beginning something or starting something new. And we are located at the moment in 2 districts of the province, 2 districts of province 2 in Nepal. We have 7 provinces. And in the first and second cohort, we are working with a total of 8 rural municipalities in Bara and Rohtak districts. And for each cohort, we are working with 4 rural municipalities spread across these districts. We have a total of 4 cohorts, and we want to finish it within a span of 5 years. We are in our 3rd year at the moment. Our project components mainly include accelerated learning, literacy and numeracy courses, as well as the life skill component that is taught along in different community learning centers that is across these working rural municipalities in Nepal, in province 2. And we also do some gender transformative workshops in school with local governments, do community engagements with families, with local leaders and local government, the newly elected representatives in different municipalities. And the kind of girls that we work with, they come from a very ethnically marginalized communities. At the moment, we're working with primarily married and out of school adolescent girls of 10 to 19 years. And in the first cohort, we were able to reach around 1,700 such girls. And in cohort 2, which has recently only started, we are working with 2,400 something girls at the moment. And to provide you with a bit of a background, these girls, most of these girls have either never been to school, or they have either dropped out in primary or secondary grades in formal schooling. More of them are married, or either they are promised to be married. The sociocultural context that we work with has high prevalence of early marriages, child marriages, although they are legally not allowed. But because of the very stereotypical and strict sociocultural norms, they are still widely practiced in these communities. And our girls, most of them belong to the marginalized and disadvantaged communities, such as Dalit and Muslim families. Next slide, please. So when the pandemic hit in Nepal, the government announced the nationwide lockdown towards the end of March last year. At the time, we had 83 community learning centers, which were operating in as part of cohort 1 in these 2 districts, and everything had to be stopped at once because of such declarations and the risks of the spread. So immediately the team came together and in consultation with the fund manager and the wider education group within People in Need headquarters, we came up with some programmatic adaptations, particularly focusing on trying to ensure that these girls whose learning had stopped as a result of the pandemic, at least they start to continue their learning at home, and at least we know where they are and how they were doing. And we also wanted to, in the near future, when the lockdown would be lifted, bring these girls back into community learning centers, because the chances of them not being enrolled or coming back to the CLCs would be huge. So we're focusing on extensive family consultations, and we prioritized that as part of adaptations. And of course, like the previous presenter, Yasmina said, like well-being and resilience, social protection and safety, those were key part of the programmatic adaptations, and like I mentioned, influencing families and communities to ensure that these girls were still continuing their education at home, but also were willing to come back to the community learning centers after the lockdown is lifted, was very crucial to all. And in the middle of all these adaptations, there was the need for the meal system to be adapted and pivoted from the sort of traditional and normal, from the normal situation. Next slide, please. So what we did and how we adapted was, so at the onset of the lockdown in Nepal last year, we started with rapid situation assessment of our girls and their families, because most of these girls were married, they were out of school, most of them were living in their in-laws' house, and because the locations of our project where we work, it's in between that open borders of India and Nepal. A lot of the marriage happens across between like Nepalese and Indian families living nearby. So we knew that a lot of girls would go back to their natal homes in India, and we would not be able to contact them, or we were not sure whether they were coming back to the community learning centers after the lockdown was over. So we wanted to have that idea and get a sense of how they were doing, where they were, and whether learning at home was possible for them. And that gradually shifted into tracking them at regular points in time. We had a very simple set of tool or simple set of questions that we wanted to ask, which were like very basic information, mostly focusing on their well-being and their whereabouts, which later turned out to be a regular and a rigorous process of collecting information about their consent to participate in our distance approaches, different programmatic activities, but also in time learning, assessing their learning. Yeah, we can go ahead with the next slide. And in doing so, we focused on two primary approaches. The first one was having that community-led monitoring of our girls, and also having a mobile-based data collection. I'm sure a lot of us focused on these two, but in our experience, what we did was, fortunately, we had a lot of community networks that we built before the lockdown, and we were able to utilize those networks. As a result, we were able to mobilize families and local leaders who basically were living together with the girls, or in fact in the same communities. They knew each other. They were always there, because this was like a very closely knit settlement, and people knew about each other. And if you had a contact of that local leader, then you would know how the girls were doing or their families were. So we used that to build that initial level of trust and acceptance to be talking to us, because in that situation at that time, even approaching them was very difficult, because we were like, the project team would be like an outsider talking to these girls and their families who were going through so much at the time. And we also adopted peer tracking, which basically meant, like how classmates know about the other, their peers, basically. So in community learning centers, 20 to 25 girls were sitting together, coming together and learning every day for 3 hours. So they knew about each other. They were living at the same communities, if not nearby communities. So they knew about each other and had information about each other. So we tried to see how the other peers were doing through the peers. So that's what we also applied to know how or where the girls were. And most of all, we were very fortunate enough to have our frontline staffs, basically our local female facilitators who were leading the community learning centers for us, and also the social mobilizers who were always there and having that regular family and CLC, or community learning centers management committee engagements. So these frontline staffs were key in monitoring and actually seeing the status and the situation of these girls for us. And they were the one who were reporting to us frequently. And like I said, since we work in a very rural community, the internet penetration is very low, and it's perhaps at many places non-existent. So we had to rely on a very simple mobile phone, and not even Android or the fancy kind of mobile phone, but a very simple mobile phone where the girls could and their families could connect with us, talk to us, and things like that. So we used those. We asked for information and asked for consent, and asked whether they were willing to participate in such programs of ours. So what we did in terms of contacting them and collecting data was, we started with bi-weekly tracking, and then we later shifted it to monthly when we had like regular touch with these girls and their families. And we also did we also had adapted the curriculum and the content into micro sessions. So we also had to adapt the monitoring system and the tool to suit to that micro sessions. And we had formed these location-wise working groups who would be leading such data collection and monitoring. And And most of all, we had to have this capacity building and guidelines that focused on safeguarding and protection, and what it would mean to collect such data remotely, what were the ethical concerns, what were the safeguarding concerns, what would be our approach in carrying out this adaptation. So these were the things that we started, kicked off, and it went on being a very good guidance for our frontline staffs. And since this was also something new for all of us, right? So like Yasmina rightly pointed, we were building the plane as we were trying to fly it. So that meant we were trying to grasp the ideas and the sense of how our community and the girls were feeling, at the same time trying to capture how they were learning, and at the same time learning and then using that learning into continuous adaptation. So having that cycle of learning and adaptations continuously. Next slide, please. I want to share like some of the excerpts that we had. So like I mentioned, we talked to the families and asked whether they were interested to allow their girls to participate in our distance teaching and learning, and also the girls whether they were willing to participate. And as a result, we did this small pilot of our distance teaching and learning approach, and we got some very good feedback, but as well as positive notes on how this could really help these girls to continue their learning. Some of these excerpts are in the slide, as you can see for yourself. One thing that I want to point out is as part of this distance teaching and learning pilot, what we also came to realize was, of course, there could be challenges as we go on, but there were also some unintended positive consequences that came out as a result of such distance learning. For example, the girls who were married and had children, young children who would otherwise not be able to go to the community learning centers, travel to the centers, no matter how shorter the distance is, they were more interested to sit at home, be with their children, and still continue to learn. So these were some of the findings that we actually came across when we did this piloting. Next slide, please. Yeah, and we used the data that we collected from regular telephone tracking of our girls, their families, our engagements with frontline staffs to modify and feed into our distance teaching and learning scale-up activities. And as a result, we were also able to feed this information into our immediate midterm response planning at the moment, which we are currently also running. And these were also very essential for us to identify the most vulnerable girls, or the girls who had these compounded vulnerabilities and marginalizations. And as a result, like some of these girls who were heavily pregnant, and because they were not receiving or did not have information about where to receive antenatal care checkups, where to seek out health support if they were in need, those kind of information we were able to provide because of this tracking, because we were continuously in touch and we provided them with information. But what we also did was we partnered through different health clusters and other clusters that became active during the pandemic to come up with mobile health camps in the communities that were most at need. And that included our girls who were needing such support and services. And there were some new and emerging learning barriers that we also identified. For instance, what does access mean in terms of having a mobile phone, or in terms of having a mobile phone, but having that uninterrupted phone call with the facilitator? So a lot of our girls were also saying that although their parents and their families provided them with mobile phones, there were also some interruptions during the lessons, and that were acting as a new barrier for them in this newer adapted context. So these are also a few things that we needed, we learned, and we were trying to incorporate the learning into our current distance teaching and learning. And of course, assessing safeguarding risks at the time and continuously feeding that into the adaptation. Next slide, please.
Devi, you have only half a minute.
Sure. So this is my last slide. So of course, with the new adaptations come different risks and challenges, as you're all aware. And since we're relying on technology, there were technological challenges, and there were some initial reluctance from families to provide mobile phones to the girls because they were married and had their own household chores, and they had to find that time for learning. And there was also this expectation. They were in the middle of the pandemic and they were having distance teaching and learning, and they were expecting some other kind of support from us. And there were, and for girls who didn't have anyone in the family to support them with childcare, there was this sort of unfavorable learning environment. And of course, the capacity was always, capacity of our staff was always challenging back then, but now I think we've come across you know, some steps and strategies to sort of mitigate that and prevent that. So thank you so much. I took a bit of time, but hope that was useful, and talk to you in Q&A. Thanks. Over to you, Mona.
Thank you, Devika. It was highly, highly interesting. And now let's go to our next presenter. We have Mochpi Matchang, who is a social innovator focusing on designing sustainable solutions for youth development. She is the co-founder of Young Love Organization, a youth-led movement that is able to reach out to 100,000 plus young people in 5 different countries. Young Love's mission is to translate rigorous research into high-impact health and education programs. Mochpi is also chairperson of the Botswana National Youth Council. Together with her, we will have also Amy Jung, who is a young professional passionate about addressing development inequities through evidence-based actions. Amy is a senior research officer at Young Love Organization based in Botswana. She prior to that worked in the global health sector with a focus on health education, primarily in sexual and reproductive health and rights in New York, Ghana, and Liberia. Okay, to you, Mochpi and Amy.
Thank you so much for that introduction, Mona, and thank you so much for the INEE for inviting us. We are really humbled to be here, and thank you all for the attendees who are joining us today. We'll be sharing more of our phone-based learning assessment and our experiences from Botswana. As in the introduction mentioned, we are an organization based in Botswana, and our mission is to connect youth to proven life-saving information. We are one of the largest youth-serving organizations in the country and closely work in partnership with the government to scale all our programs in education and health to all schools in the country. So you could see from the introduction picture, this was us before the pandemic, when we were very much based in classrooms. Next slide, please. So prior to the pandemic, we were scaling an intervention or an approach called Teaching at the Right Level, which is pioneered by an organization in India, Pratham, and has worked in multiple countries through randomized controlled trials. Teaching at the Right Level is an approach in which students are assessed according to their different learning abilities and then provided with targeted instruction that is at their level. So for example, in maths, students would be grouped according to addition, subtraction, or multiplication or division, and then the material will be tailored according to their learning levels. Prior to the pandemic, we were reaching 20% of primary schools in the country and very much closely working with a collaboration of partners as shown below. Next slide. Our COVID-19 response, details a low-tech education approach. Please just hit next because I realize it's a transition. So if you could just transition to all. Great. So our COVID-19 response was to say that when schools shut down, 3 days before school shut down, we quickly collected phone numbers from the parents and students that we already worked with. We didn't have an idea what we are going to do with these numbers, but we knew that we wanted to still be connected to the young people that we closely worked with. So we collected phone numbers to be able to really reach out to these young people, we found that almost 10 to 15% of low to middle income countries have access to internet. In Botswana, when you're now moving to rural areas, no one has access to internet, but someone has access to just a simple phone. In Botswana, we have 120% penetration rate of anyone who has access to just a simple phone. We also saw that parents were really going to be the key drivers in delivering information to young people, because most young people don't have access to their own phones, but also just someone at their household level has access to a simple phone. So this, process really brought a new introduction of how do we work with parents and how do we deliver information and learning material to parents. We also did this through a rapid evidence trial. We worked with colleagues from JPAL and Columbia University to be able to deliver 2 interventions. The first intervention included weekly SMSs or text messages sent to parents and students. And then the second intervention included a combination of SMSs and phone calls delivered to parents and students. And from these experiences, which we'll share more on lessons on this front, we're hoping that to share widely with the network as well as with government on policy implications as it results to low-tech learning. Next slide. These is just an example of the interventions. They include SMSs, and then the second intervention include SMS and phone calls. To just note from the slide is all the activities that we sent either on SMSs or delivered via phone call, they were targeted to the students' learning levels. So this essentially means when a student was at addition, we will send them addition material, because this is one of the adaptations that we have learned also from the teaching at the right level approach. Next slide. Yes, as we mentioned, we conducted a rapid trial. We collected, thousands of phone numbers initially on the phone numbers collection. And then we also collected, consent from parents that initially wanted to consent to the program. Please just hit next, because I realize it's transition. Sorry about that. So we collected phone numbers from students, and then there was an initial dropout rate of 13%. But however, we had a high, take-up rate of 71%. The initial first stage that we took was to conduct phone assessments, and we'll show with you the tool that we use, but we had to tailor approach of how we used to do it in person, but also now how we would conduct, phone-based assessments over the phone, which we're excited to share with you our lessons on that front. Next slide, please. This just shows an example of the ASA tool that we used to assess the different levels that the students were in. We had to tailor this approach to over the phone, and we can share more of these experiences. This ASA tool would typically take us 5 to 10 minutes in person, but however, because it was done over the phone, it took a much longer time of up to 20 minutes, where the assessor as well as the student had to be on the phone conducting this assessment tool to see which level the students are at. I'll hand it over now to my colleague Amy Zhang, who will be able to walk us through some of the M&E processes as well as lessons on conducting phone-based assessments. Thank you.
Thank you, Devi. Can you please go to the next slide? Thank you. I'll now dive deeper into the M&E system. Here is an overview of the tools and platforms we use in each implementation phase. Pre-implementation, we utilize WhatsApp for communication with their facilitators and to train them fully remotely. To disperse calling airtime, we utilize a platform called DT1. During implementation, we used a platform called New Line Technology to manage bulk SMS to send practice problems to participating households. For data collection, we use Survey CTO to collect household engagement, student level, and other program-related data. Next slide, please. Thank you. Here is a step-by-step on what we did to train our facilitators for data collection. Firstly, we prepared training materials such as calling guidelines, which includes a script to follow during the call and specifications for data collection in PDF documents. Trainers will send these PDF documents as well as any supplemental resources via website links 1 day before the trainings. The training took place on WhatsApp group chat to create a virtual training room. Trainers sent short voice notes and videos to give in-depth explanations of key concepts. Next slide, please. Thank you. This is a sample schedule of a weekly reoccurring data collection. In this chart, I'd like to bring your attention to Tuesday, when we hold trainings and distribute calling guidelines, as well as send bulk SMSs to treatment groups. Immediately following the bulk SMS delivery, we begin calls from Wednesday to Sunday. All the data collected for that week is submitted on Monday morning, and the rest of the day is used to clean and prep the data for the following week. We hold refresher trainings as needed on Tuesdays, depending on anecdotal feedback or the data quality. Calling guidelines are also iterated and updated as needed. Next slide, please. Thank you. To transition to the results, on the left-hand side is a graph that shows treatment effects relative to the control group. Effects are expressed in a standard deviation for comparable units. Each color bar represents a distinct learning question. Average level reports skills on ASAR 0 to 4, corresponding to no operation all the way up to division. No operation means students cannot perform any numerical operation, which is also called innumeracy. Our results shows large statistically significant learning differences between treatment and control group after 4 months of intervention. The results suggest that combined phone and SMS intervention can generate substantial learning gains that translate into 31% reduction in innumeracy and increase in average numerical operation learned. Because of the time constraint, I'll skip to the next slide. Thank you. We tested the robustness of our learning outcomes in a few ways. We randomized 5 problems for each proficiency for all addition to fractions. And as you can see on the table on the left-hand side, we found that the phone-based learning assessments have a high level of internal reliability. We also differentiated effort from cognitive skills with real effort tasks with a riddle question, and the results showed that learning gains due to the interventions are largely a function of cognitive skills rather than effort on the test. Next slide, please. This is our final slides. It's the key practical lessons we identify for phone-based assessments of learning, which happen to overlap with the key takeaways in the INEE technical notes. And since it overlaps, I will not go into much detail. I'll run through the first 5 very quickly. First was to protect the children. Second is to test the reliability and validity. Third is to keep the instructions simple and use practice problems. Fourth is that some assessments are more conducive than others. Fifth is that we need to account for sample bias, as Yasmina also mentioned. And at this point, I would like to turn it back over to Moitepi to wrap things up. Thank you.
Thank you so much, Amy. And I think this also just touches on a lot of what Yasmina shared. Can you just go to the previous slide? Yes, the sixth lesson is just to keep it short. Sometimes when you are doing phone assessments, we also are working with parents, and usually, they want something simple that they're also able to understand. So whether there's a text message or just even a phone call, keeping the conversation very short and very precise. But also the second point, which is worth digging into a little bit more, is experimenting to get a phone response take up. So when we initially started, we had to call all the parents and phone numbers that we had collected to ask for their consent on this program. Were they interested in seeing this, receiving these text messages and phone calls? And if they were, which times were they available to do this with their students, with their children? So it was very important that we figure out ways to increase the phone and response rate, but also establishing rapport. I think this one is obvious, but it's very important that when we are conducting, phone-based assessments, to protect the child, to also establish a learning and working rapport with the student, not to make it seem as if they're in one big examination. And again, choosing cost-effective approaches. We found that two-way texting was logistically harder. It could be that parents don't have access to airtime, so we needed to really make it very much more simple to ensure their engagement. And we also found that lower take-up. We found that there was a lower take-up on that front, as well as phone calls. So we are finding ways on how to really implement, cost-effective approaches on this front. The next slide. The next slide just shows our two publications. The first one is just more on the lessons and results on conducting this rapid trial of our low-tech intervention. And then the second publication is on the practical lessons for phone-based assessments on learning, which we have just shared on this presentation. The next slide. Thank you. That will be it on the Young Love side. Is thank you in Setswana, and thank you so much for engaging on this presentation.
Thank you very much. It was highly interesting. And now we will go very quickly to our next presenter. We have Barbara Harvey, who is a teaching and learning technical advisor for the Girls Education Challenge, which was launched by the UK's Foreign, Commonwealth and Development Office in 2012 to reach the most marginalized girls in the world, and is actually the largest global fund dedicated to girls' education. She has an extensive background in education and international development in a number of different African countries, and has worked with the Girls Education Challenge in various roles since 2013. Together with Barbara, we'll be presenting Kenneth Wala. Kenneth works for Link Education International and is the team leader for Team Girl Malawi project being implemented in Malawi by a consortium of 5 NGOs. He is an experienced strategic project management and social inclusion expert with over 12 years practical experience in humanitarian and transformational development programming. Without further ado, to you, Barbara and Kenneth.
Good afternoon, good morning, good evening to everyone. I hope you can hear me. Great. Okay. Thanks so much, Mona, for the lovely introduction. What I'm going to be doing today, along with Harry Walla, is to take you through the guide which has been developed for designing and monitoring distance teaching and learning interventions, which has come about via a collaboration between the Girls Education Challenge Fund management team and EdTech Hub. So basically the fund management team for the Girls Education Challenge wanted to understand how different distance teaching and learning modalities were being delivered in projects. The funders of the GEC, the UK government's FCDO, or Foreign, Commonwealth and Development Office, suggested that the fund management team and EdTech Hub work together to design a monitoring tool to assess distance teaching and learning delivery. The process resulted in this guide, which other projects can use to help in designing, adapting, and monitoring their slides. So let me just move on to the next slide. Thank you very much. So with the advent of the COVID-19 pandemic, as we all know, many countries took measures to prevent transmission of the virus, including closure of schools. This meant that many education interventions, including for the Girls' Education Challenge projects, had to swiftly pivot from in-school activities towards provision of remote learning opportunities. The Girls' Education Challenge Fund Management team sought to support projects as well as to learn from what the projects are achieving. And so specifically, as the points highlight on this slide, we were looking to identify which characteristics hinder or enable a successful distance teaching and learning approach across the Girls' Education Challenge projects, to support projects in thinking about the areas they need to be creating or adapting a distance teaching and learning intervention, and to share findings not only across the Girls' Education Challenge portfolio, but also with the wider sector. So during sort of the collaboration process with EdTech Hub and the fund management team, it was identified, it was agreed that there were 5 key domains that projects and implementers should consider in terms of developing or adapting their approaches around teaching and learning in the remote learning context. And these 5 domains are as outlined here on this slide, including number 1, local context and education system. So a range of guiding questions in our guide requires or helps projects and implementers to consider what the local context looks like, what the national education sector plans and strategies are, and what the needs of the girls in each country are. So the second domain is around modality and the different methods or approaches that could be used in terms of providing a distance teaching and learning approach, whether it's going to be high tech or using the internet, or for example, low tech and using paper-based and so forth. So thinking about what's appropriate for the context. The third domain is around content and curriculum. And so there's a set of questions within the guide that projects and implementers can use to consider what the content and curriculum of the distance teaching and learning approach should consist of, whether it should be presented in digital or print form, and questions around whether there is delivery of a national curriculum or an alternative learning program. The fourth domain is around pedagogy and assessment. And pedagogy, obviously referring to what would be the most appropriate questions around what would be the most appropriate approach used by teachers to promote learning in this remote learning situation, as well as thinking about assessment. And I found the previous presentation from Young Love very interesting because they've obviously thought very deeply about the assessment approach. And this guide that we have worked on will help projects and implementers to consider this. And then finally, the fifth domain is around monitoring, evaluation, learning, and adaptation, including impact. And so in each case, within the guides, there is a set of questions that projects and implementers can look at, reflect on, discuss at any point during implementation to consider how well they are delivering on their distance teaching and learning approach. To give an example of the kinds of guiding questions that are included, I'll just draw from domain two modality. And one of the questions there is, what distance teaching and learning modalities reach learners most effectively? For example, mobile phones, radio, television, online learning, or paper-based materials, or different combinations of these. So that's an example of the kind of question that can help to guide discussions and reflection on the part of implementers and projects. I think I want to emphasize at this point that what we've developed is a guide and is not prescriptive in any way. It can be used by projects and implementers to revisit their interventions from time to time as circumstances change. And you'll note that there are cross-cutting principles that we also take into consideration in the guidance around equity, safeguarding, cost effectiveness, and sustainability. Go to the next slide, please. Okay, so in terms of the developing and piloting the guide, as I've mentioned already, the fund management team from Girls Education Challenge collaborated with the EdTech Hub to create the guide. And projects, a sample of projects contributed to the guide content through filling in a tool to show what their distance teaching and learning approaches look like. And a workshop was held between the fund management team and EdTech Hub to draw out key themes from these sample tools and to determine the areas of prioritization. So this is actually where the domains came from. It was through a dialogue with a sample of projects and between the fund management team and the EdTech Hub. So in terms of the piloting the guide, we engaged with 3 projects in Nepal, 2 in Uganda and 1 in Malawi, to, if you will, test out the usefulness of the guidance questions, the tools itself, and to get their feedback. And this was then followed up by the projects who then utilize the tools using team members from their country offices to reflect on their distance teaching and learning interventions. And then following that, the project team members and one of the teaching and learning technical advisors then had a discussion to discuss aspects of the completed guide, including the strengths and challenges of their distance teaching and learning approaches, the value, use, and usefulness of the tool itself, and then considering what the future application of the tool might be. Having said that, I think I would like to now pass over to my colleague from Team Girl Malawi, Harry, who's also on the call. I'll just briefly introduce a little bit about the project and then over to him. Team Girl Malawi is a project, Leave No Girl Behind project in Malawi. The lead partner is Link Education, and it has a number of other partners within the project, including Theatre for a Change. The Leave No Girl Behind projects across the GEC are working with particularly marginalized groups. And this is the case with Team Girl Malawi. They're working in 3 districts, Dedza, Mchinji, and Lilongwe, delivering complementary basic education to 6,000 out-of-school girls and 1,200 boys, including children with disabilities. Other interventions include girls' clubs, life skills, teacher training, mothers groups, community listening clubs, and livelihood training for girls and boys in CBE classes. That said, let me pass over to Harry to take us through the remaining 2 slides.
Thank you so very much, Barbara. So my role is just to present to you how Team Girl Malawi made use of the so when it became apparent that the schools remained closed for a long time because of COVID, the government gave some guidelines to say that learning must continue even when the learners were at home. So several options were given, like radio, for primary school and public schools, and also internet for higher classes like universities and also private schools. For Link, we did a study to understand how our learners would benefit from these approaches. And we talked to about 11% of our learners that were enrolled to check if they are ready, to access learning during this period. And we found out that 56% opted for radio, and 88% opted for phones, 69% opted for internet. Now, we understood our context. Now, to decide which distance learning modality or distance teaching modality we need to adopt, we decided to check with our learners further, and we found out that of those learners that we identified or we talked to, 80% had no phones, 56% did not access radio, and 69% did not access internet. And so the chosen modalities by the government were not applicable to our learners, and therefore a different method altogether needed to be found out. And therefore we adopted small groups, and which we're calling study circles. In deciding the content and curriculum, given the time that we had that time, we decided to reduce the curriculum. It had 7 subjects. We reduced to 4 subjects and focusing on the subjects that we thought they have a higher thrust to numeracy and literacy. And we also added some instructions on how our teachers or facilitators would approach this kind of teaching and learning modality. So when it came to delivery of the chosen modality, we changed the roles of our teachers or facilitators. At first, there were 2 trainers and 2 assistants per center. We changed to 1 trainer per center, each having 15 learners. And previously, there were 6 learners in one class. So that made it possible for the facilitators to be able to reach out to the learners, and we train them on how they can deliver the revised content, and also how they can support the learners. When it came to reflecting on the guide, the distance teaching and learning guide, we noticed that please, next slide, please. Sorry for that. Yes, we noticed that as a project, we moved first to understand the context. Otherwise, it was difficult for us to provide that which the government had directed. And while we were obligated to align to the government directive, the nature of our learners and our objective made us to adopt a different approach from that which came from the government. The adaptation also led into increased spending in terms of capacity building and more teaching and learning materials. You recall that, like I mentioned, we moved from 1 center to 4 centers. This meant making sure that each center has sufficient materials. And due to the need to respond rapidly, we developed materials for that term, the term in which we piloted this or implemented this. And the rest, we were developing them as we went. In phases, so to speak. We also noticed that we developed a remote assessment for our learners. At first, we were monitoring our learners using physical contact, but with COVID, this was not possible. And so we developed some remote monitoring tools in compliance with government restrictions. We adapted key lessons from the distance teaching and learning era that we have taken up to the post-COVID period. And these are one, the tracer study. The tracer study uses the phone to contact the learners or their guardians. We have also adopted home learning as one of our thrusts to strengthen our teaching. We noticed that it is important for a learner to go on, take some work home so that they can be supported by either a guardian or a sibling. The DTL framework helped to conduct reflection on our DTL strategies. Just to mention that the DTL framework came when we had already started to make some adaptations, and therefore it helped us to reflect on what we had done, whether we have we are in line with the guidance, but also its absence helped us to to innovate. We brought a lot of issues that really helped the project. On the other hand, the issue of safeguarding, the tracer study helped us to unearth safeguarding instances which would otherwise would not be reported on given the environment that was there. And our team was able to, follow them up and resolve them through referral to the relevant authorities, but also providing the psychosocial support. So in summary, I think this is how we made use of the distance learning framework. And back to you, Barbara.
Hello again. Just to finish off, first thing to say is to note that in Nepal, as witness our previous presentation from PIN, the project there has also used the distance teaching and learning guide to consider their and to reflect on their approaches. So they were part of the piloting of the tool as well. And it's an ongoing process, I think, as well. I have put a link in the chat to a paper written from Link Education regarding the adaptations they've made to their approaches in response to the COVID pandemic. I'd also like to note that what we think will be very useful with regard to this guide is that it can help projects and implementers to utilize a blended learning approach. So linking of in-school and remote learning options. So it's not a one-off for just when there is a school closure, but rather a way of linking both home and school learning, as Harry has indicated in his comments as well. The guide is just being finalized now, and we will be sharing it soon. It's just having the final tweaks, and we will be sharing that. And the plan is that the Girls Education Challenge will organize a webinar in the future where we will be exploring how to use the guide in more detail. Thank you very much.
Thank you, Barbara. Thank you, Harry. It was highly interesting. And I do think we are all looking forward for that important tool. To you now, Sarah and Asim, for the Q&A session.
Thank you, Mona. So we'll start with Devika. So Devika, we have two questions regarding the measuring aspect of psychosocial and emotional well-being. Like what tools did you use to measure social and emotional well-being? And did you collect any baseline data for this?
Thanks, Asim, and thanks for the question. We didn't use any specific tool at the moment at the time of lockdown. What we utilized were the information that we had that came out through our regular telephone tracking. And we used that information to conduct some purposive sample-based key informant interviews with some of the girls that were being seen as perhaps more at risk of some safeguarding and protection issues, and also in terms of vulnerability. So we used more qualitative inquiries instead of a certain standard to explore how they were going through in the pandemic situation.
Perfect, thank you. So another question for you is, how did you measure learning on mobile phones in practice? What kind of questions did you ask? Did you, for example, measure literacy and numeracy as well?
So it has to be seen as something that we did before the lockdown and in between the lockdown and what happened after the lockdown was lifted. So we had developed a guideline based on the teaching and learning curriculum that we had and that we were providing to the girls. This guideline on learning assessment involved facilitators scoring their learners as A, B, and C categories, depending on how far they were learning within the normal sort of community learning center environment. But when we pivoted to more remote setting, we focused on tracking that change in the learning instead of having that one point in time learning assessment, because we thought that was more suitable for our context and for our girls. But when the lockdown was lifted and the time when we were sort of collecting data on learning, we did use early grade reading assessment, EGRA, and early grade mathematics assessment, EGMA, in order to evaluate numeracy and literacy.
Perfect, thank you. So moving on to Young Love, Mustafi, a question for you is that around assessments, how did you conduct assessment of initial learning levels of students?
Thank you for that question. So we used the ACE assessment, the one that we showed on this slide. Is just a simple, assessment that's used in various countries, but also just showing, the level or the ability of the student. So we conducted using it for the phone-based assessments.
Perfect. Another question is, did you condense or prioritize the curriculum before implementing the initiative? What criteria did you use for condensing the curriculum?
That's a very good question. So initially we were implementing the teaching at the right level approach in the country. And this is very much, I would say more of a teaching methodology, and has also taken in factor the national curriculum. So what we did, because we are now delivering it via the phone, we really did have to, as you say, condense it to be able to choose, the appropriate material that can be delivered over the phone through SMSs. Because when you send out an SMS, it has, 320 characteristics at maximum. So we really had to, shorten the activities to be able to deliver this over the phone, but also through SMSs. So again, it is more of a tailored approach of teaching at the right level, but something that is also very much aligned, or rather the activities are aligned to what's already being taught in the classroom.
Thank you. One other question for you is around what was the tech intensity of the distance learning interventions in relation to normal class-based intervention? How were the results compared in relation to the intensity of each intervention?
Thank you. Amy, do you want to take that one?
Sure. Thanks, Tippy. So where possible, we try to link students to the school assessments data that we have. And what we found a high correlation in both of the results, the phone assessment and the face-to-face assessment. And when you compare the two interventions, the face-to-face in-school interventions is about 30 hours intervention, and the phone intervention is about 3 to 4 months, which is only an hour per week. So it's substantially less frequent and less in time, but we found that the results were highly correlated.
Perfect. And did you train teachers for giving this telephonic support as well?
Yes, we trained our young love facilitators all remotely each week.
Perfect. Thank you. So this is all. I think we have covered all the questions. Thank you to all panelists for giving really comprehensive answers. Over to you, Mona. Thank you.
Thank you all. Thank you very much. I do think it was a very constructive and a very informative webinar with a lot of highly interesting interventions and a lot of lessons learned. Thank you all.
Right. Thank you very much, Mona and Asim, and everybody who participated in this webinar. In behalf of the INEE, I would like to thank everybody. And also, please keep in mind what everybody was saying at the beginning of this webinar. To deliver education, we need to take self-care and keep safe and keep healthy so we can continue the work. The COVID pandemic is not over, but the education need to keep going. So say that again, thank you very much to everybody and the effort for the people in the field office and the field operations and the country office who continue delivering education for the people in most need in these difficult circumstances. So to close that, I would like to give the floor to Asim because this is a collaborative effort for the distance education learning. So Asim, closure words is up to you. Thank you very much to all.
Thank you all for taking out time and connecting, and we look forward to you joining us on a range of webinars and other discussions we have planned under the Distance Education Reference Group. So the Slack channel goes live next month, and we look forward to you joining and a range of discussions. So the idea is to develop an informal relationship with all the members interested in distance education. So we'll keep this formal engagement and informal engagement continued in the next year and this year. Thank you.